This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. We're at the Aurora Health Center in Oshkosh, and we're in the OB/GYN department because today we're discussing healthy pre-pregnancy. And we're talking about healthy babies, and we're talking to Dr. Kathryn Murphy. And I suppose when we're talking about healthy babies, that starts before the pregnancy. And why don't we talk a little bit about what a healthy pre-pregnancy is?
A healthy pre-pregnancy is a healthy woman. So she needs to be up to date with her annual exams as well as her vaccinations. Many women forget the fact that they may not be vaccinated against, say, varicella, which is for chickenpox. That can't be given during pregnancy, and you definitely don't want to get chickenpox during pregnancy. So a woman should probably make sure that she is not only probably in the best shape of her life, unfortunately to say, but it's true. She should also be up to date on her vaccinations, and ideally, you'd like to be in your normal body range of weight. A little over, a little under is fine, but if you get too far over or under your ideal body weight, there's difficulties not only getting pregnant, but having a healthy pregnancy. It can really have an impact on the baby. If you have any chronic medical problems, such as high blood pressure or diabetes, those need to be under very good control before you get pregnant. They become even more difficult to treat while a patient's pregnant, and they can actually prevent a woman from becoming pregnant. So you need to see your primary care doctor. If you've got blood pressure issues, diabetes, those have got to be under good and tight control before you get pregnant. Also, smoking. Smoking is a big one. You should not smoke in pregnancy. It is harmful to you, it is harmful to the baby. In general, no doctor is going to advocate smoking at any point in your life.
Right. When you're talking about these habits, and some people might have to change their habits, how soon do you recommend that they start changing those habits before they get pregnant?
Realistically, when you're talking about the chronic health problems such as diabetes and blood pressure, you probably need to have those under good control within 6 months of getting pregnant. Like I said, they can actually cause you not to get pregnant, so those have to be under control. And probably when your body does get pregnant, those are in good shape. You're in good control there. As for that, I mean, I'm always going to advocate a healthy lifestyle throughout your entire lifetime. I don't think there's a time when you can just give up with that. So I think any woman who's in her childbearing age should consider eating a good variety of foods, have a good diet, healthy exercise, and live a healthy life.
Now, I know one of the more difficult things to deal with is taking supplements. The pills are a little bit large, but a very important part of pregnancy.
Yes. The prenatal vitamins are formulated differently than a regular women's vitamin, usually to make sure they have enough folate. Women need to be taking in 400 micrograms of folate daily before they get pregnant. The folate helps prevent getting spinal tube defects such as spina bifida. So a woman who's considering getting pregnant within the next year or two should probably start taking a prenatal vitamin before she gets pregnant. The other supplements beyond that, I caution some of those evening primrose oil, some of those raspberry leaf tea. Those are not FDA approved, so use with caution, but those are out there as well.
Okay, and let's talk a little bit about planning now for a pregnancy. Should a woman come see you or a doctor before they get pregnant?
Well, a woman should be seen every single year for her annual woman examination. She needs a breast exam, a pelvic exam, and a pap smear. So a great time to discuss that with your doctor, whether it be an OB/GYN, a family practice, nurse practitioner, PA, that's a great time to talk about it, is at your annual exam. Say, hey, you know what, in the next year or so I'm thinking about getting pregnant. Is there anything I need to do? Otherwise, if they have some questions because they're thinking about it, that's a worthwhile visit to any doctor.
And of course, planning doesn't always work out the way we want it to, and sometimes there's unexpected pregnancies. If you suspect that you're pregnant, how soon should you get to a doctor?
The ultimate answer is you can come and see us, me, anytime you feel like you need to if you have questions. But if you call the office, we probably won't schedule your first OB visit until about your second missed period, so usually about 6 to 8 weeks into the pregnancy.
And when a woman comes in for her first exam at that point, what can she expect?
Most of the time, in a lot of practices, and I know in my own, you'd actually meet my nurse first. And when you meet the nurse, she's going to go through a lot of the education with them, and they probably may not see the actual doctor for another week or so. The nurse will decide, does she need an ultrasound, that kind of thing. Then they will usually talk to me if they have any questions. And that's a great time because then the nurse can spend a lot of time, sometimes it's up to an hour and a half visit to go through all of the education of the early pregnancy. And so other places, you know, if you meet with the midwives, they actually will be, the midwife will see you at the first appointment. But don't ever think that the doctor's not in the loop, because we're very excited every time we get a new OB patient.
All right. And do you recommend when a woman wants to see you or another doctor that they just make an appointment with you, or is it necessary for them to have a referral to get in to see you?
If you suspect you're pregnant, or you've even confirmed your pregnancy with a home pregnancy test, the best thing to do is call your insurance company. Some insurance companies do require a referral to the OBGYN, but typically for pregnancy, you can usually just make an appointment with the OB office.
All right. Well, it's all about making healthy babies. Dr. Kathryn Murphy, thanks for joining us today.
Thank you.
If you'd like to know more about healthy pre-pregnancy or to schedule an appointment with Dr. Murphy, you can call Aurora Health Center in Oshkosh at 920-303-8700. I'm Ted Stefaniak. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.